The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone. This is Pat Hennessy from Beere&Purves. 9/11, and we all remember where we were 17 years ago on this day. I was actually in a San Francisco airport getting ready to go to Chicago, and we had to leave the bags and head out. So we really have heavy hearts with the folks 17 years ago today. But moving on to healthcare and the fourth quarter. All the information you're going to see today is going to be given to you in a presentation this evening, so don't worry about frantically writing notes. It'll all be available to you. And today's purpose is to really make it very clear as to what you need to know heading into the fourth quarter. There's lots of materials, but we boiled it down for each carrier to very specifics. And the information you're going to get today is going to help you be more efficient as you're going through your fourth quarter busy season. The key message is the help is here. So please make sure that if you are overwhelmed and you have a lot going on, quoting wise, enrollment wise, please let us know. We have capacity available, and we're always look forward to helping you. So as we move forward, some of the resources that are available, we just want to remind you, we've upgraded quite a few things here. We have a full staff here in Walnut Creek, so underwriting team, enrollment professionals that are on standby to help. The comparison tools, we're going to go by a couple of these in just a moment. But one of the key things I wanted to share with you under the tools comparisons is the provider and pharmacy searches. We have a gentleman here named Patrick Kim. And what we're finding is that when we move a group, and let's say we go from Blue Shield over to United Healthcare, what's happening is the rates we may save the employer 10% on their premium, but we didn't really look at the providers and the pharmacy that could have a serious impact on the executive team, and specifically the owner and the owner's family. And so what we're doing now is, before the group officially moves over, we actually ask that you provide us a list of the owner and the owner's family, as well as the executive team, the list of doctors and medications that they're on. And then what we will do is run a side-by-side comparison onto the new carrier that you're actually going to be moving them onto. And that way they'll know exactly ahead of time, are they going to have the same level of coverage for doctors and for medications specific to their needs. Because at the end of the day, if the owner has a specific medical condition and they're going to be moving and did not realize that their specialists and the medications they're taking are not going to be covered, the whole group can blow up. And we did see this happen already. So please be mindful of that. It's a free service for you, and we're looking forward to at least making sure that you've got the information ahead of time to share with your management team. And it really is a huge value add to make sure that they're comfortable when they do make that final decision to change carriers. We do have the EaseCentral connectivity. We have a team here that does the online setup. And that way all your groups will not have any missing items, because they can't advance to the next screen until they're enrolled. And then we actually will go ahead and electronically send the enrollment to the carriers, those that take it automatically, and print out the apps for those that actually need it, like CalChoice, on a paper app status. What's happening is 10% of our groups are now going to be on EaseCentral. We are expecting this to increase significantly over the years ahead. Millennials don't like paper. And what we're finding is that the more enrollments we do, and when we bring up an online enrollment without paper, depending on who the audience is, some of them love it. And it's important for each and every one of you on the phone today, always offer the online enrollment to your groups, because some brokers are leading with this. We did have a broker that lost a group because they did not offer it. And as the incumbent, the group didn't know that they could do it and went with another broker. When they came back and said, hey, we can do that, it was already too late. So please offer the online enrollment. You're going to see that is going to pick up on a going forward basis, and that's where the future of this business is going. The submission business, again, everything is submitted electronically to us. All the rates, benefits, networks, all available online. And so those are some tools and technologies you want to embrace, because, as I mentioned, this is where the industry is going. In return for working with you, we want to help share the costs associated with getting the business and keeping the business on the books with you. The underwriting component with EaseCentral, there's a $1.40 subsidy per employee per month times 12 that we will pay you for those that do have an EaseCentral account. That helps lower the cost to you for EaseCentral. For those of you that don't have an EaseCentral account, the EaseCentral is free. And then you can select from another one of our broker picks programs, whether it be first year Cobra or a variety of other options that are available to you at no cost. So please take advantage of this. We do know that the cost of keeping business on the books is getting more. So in order to maintain your profitability, we are happy to share in that and pick up some of these expenses to really keep and maintain your profitability at your agency level. When we go over to our people, we've been very fortunate to have a lot of tenured people here in the office that are very experienced, and that's really how the responsiveness is the only way we differentiate ourselves. So we say it's our people and the tools that we have that differentiate us from other GAs. And I would encourage you to make sure that that you do use Heather as well as Tracy. Those are your quoting team, and our underwriters here are always available to help you. The quoting enhancements, these are items if you're going to be doing your own quoting, and a lot of brokers do their own quoting. Make sure that you give us your logo, because we can actually apply your logo to the Health Connect quote, and it looks customized. And that's what we want to do. We want to, at any opportunity to help you differentiate yourself from other brokers that you're competing against, having your logo on there is critical. So give us your logo. We will put it on the quote engine, and that way your quotes that come out have a customized look and feel. And it's a very positive thing when you're presenting to your group and they see your company information on there. The multi-option report has now been easier. As you know, if you do have 5 bodies, and we're going to put 1 person on each plan, it was labor intensive in the past. Now we have an auto mapping feature, and that will actually take the employee from company A to company B and make that comparison very easy. At the end of the day, you want to make sure that you have all the employees on the renewal, and then a like plan, and that way you'll be able to do the apples to apples comparison so you and that employer can make a final decision. The table rates are now also based on the employer contribution. In the past, we would just give you gross table rates, but now if it's 50% employee contribution off of the silver plan, and we run a new hire worksheet, we can go ahead and calculate that contribution in, so the net rates are what that employee sees, which is very helpful. And finally is the website. I'm going to show you the website later today, but the website has all the SBCs on it, all the brochures, everything you need for your current plans, your renewal plans. And this is going to be really helpful for you as you're going through these renewals to make sure that you're able to get through these as efficient as possible. And all the search features are there as well. So now let's talk about some of these tools. The first thing we're going to talk about is this Q4 timeline. And this is going to help you stay on track. So what we're doing now is the Q4 checklist. Now this started back in July when the rates became released. This is basically best practices. And again, as I mentioned, I'm going to share this and send this to each of you. But what's happening is each month you want to stay on task in order to go ahead and not let this snowball into a bunch of work at the end of the year. So we know that the rates are being released. We start the quoting process. In September, which is where we are now, you want to be presenting options. You want to get decisions in September. We want to provide those provider and RX searches now. And then if you need the enrollments, either online or soft copy or hard copy, let us know. We'll go ahead and send those out to you. We can do the EaseCentral exports. And then we also have unlimited meetings. A lot of the carriers are in a situation now where they're under some resource constraints. We have interpreters that we can send out to you at no cost. So if you do need a Cantonese right next to you, we can have the Cantonese conversation at the enrollment meetings to make sure that everything you're communicating is being clearly understood. Now we go into October. In October, you'll start submitting business. We have all the resources available to get those approvals as fast as possible, and again, take advantage of the online portal. In November, you want to continue to submit business. Now, once you hit November 15th, now we're into crunch time, and again, you want to remind them for the 12/1 renewals, fill up your medications, because we want to see if we can get you in the system, because the carriers are going to start slowing down. because of the volume of business that they're being asked to generate or to process. And then we also want to get that prior deductible credit information if you can at the time of enrollment. If you can't, go ahead and get that as soon as possible thereafter. What happens in December is most of us take a breather because it has been a lot of work to finally get through December. But what happens is the carriers have been racing to go ahead and get all the information processed. And unfortunately, from time to time, there are mistakes. So it's important for you to audit the information, make sure that they're on the correct plan, the networks, the names are spelled correctly, and let's get the PCP corrected right now. Because a couple of months later down the road, if you didn't audit the bill, the changes are very difficult to get. And a lot of carriers are not making retroactive changes. So we want to make sure we get that done now. We want to cancel that coverage that's in place. And then if you want to have any training, for example, let's say I'm not using EaseCentral. We're going to move a group from Blue Shield to Blue Cross. We have what's called an e-training person on that can go ahead and set the employer up with training on how to use the e-services at the carrier level. So how to use the add and delete set agent services for Anthem. So 30 days after the group is set up, if you would like to schedule a meeting with your HR professional and our team there, we will tell them how to get their ID, password, and how to walk through and do all the adds, deletes, everything online directly into the carrier system, which is very efficient. And we have a lot of brokers that take us up on that. So if that's something you want to do and make that part of your onboarding process, please do that. And a month, once things settle down, we go ahead, have a conference call, and it's really how to use and make the most of the carrier online tools. And I would encourage you to do that. Now what we're going to do is, the other thing I wanted to share with you was what is selling here in the Bay Area. So the most competitive plans by county. And what we've done is we've gone ahead and let's look at, for example, the area we're in now for the fourth quarter. So you look at Contra Costa County, which is right here. You look at the plan designs, platinum, gold, silver, bronze, and then we have a silver HSA and a bronze HSA. You'll notice Anthem has dominated the fourth quarter for Contra Costa County. If you go over to Alameda, you'll notice it's Blue Shield. So again, this is broken down into the 19 rating regions. It tells you which plan is the most competitive in that region. So if we know, for example, that the group is on let's say a Health Net plan, and we're in Contra Costa County and they're on a Gold 750, we would know that the most competitive plan at the Gold 750 level in Contra Costa is Anthem Blue Cross. We also know by these percentages here that it is the most competitive plan. The next most competitive plan for the Gold 750 is 9.7% more expensive than the Anthem plan. So now we're almost looking at a 10% increase. It may be, in this situation, we may definitely want to move them to Anthem. In this situation down here where we're silver, you'll notice that the plan differential between the Anthem Silver and the next most competitive silver plan is only less than 1%. So we may want to just leave them where they're at. So this gives you a good idea as to what is the most competitive carrier. And then in addition to that, what is the second most? And you can see the differential here. Very helpful tool as you're streamlining your renewals to say if they're already on Anthem, leave them there because they're on the most competitive PPO plan being offered. Again, this is for PPO only, Northern California. As we scroll down, you'll see that these are the other carriers in Northern California. And then here's Southern California here based on zip code. So all the 19 rating regions are listed. And again, if you want to know where that employer is located, if the employer is located in any one of these, you look at the rating area and that will go ahead and determine which one is the most competitive. So those are just a couple of the tools we wanted to share with you. Now let's get into the carriers. And you'll notice here why sell Aetna. So Aetna has not been competitive other than the bronze. They have been extremely competitive in the bronze. So if you do have plans and groups that are looking at going to a bronze plan, please consider Aetna because they have been extremely competitive in that arena. The one thing we wanted to make sure that you're aware of is they had a rate pass between the Q3 and Q4, and the annual rate increases on the PPO is 0, and you'll see the HMOs for Northern California is 5.3%. Southern California had a big increase of 10.5. As far as the rates go, Now we're going to talk about when are the rates coming out for Q1, which is 1/1/2019. They basically told us they're going to be coming out in is October 1st. So that's what you can tell your January groups. We can expect rates to be released in October. And what have they done in 2019? They're looking at actually a 0.5% increase on an annual basis and a decrease for the HMOs. And as I mentioned, they're very competitive in that bronze arena. The top selling plans year to date for the Aetnas are listed here. And again, we've sold a lot of this bronze HSA plan. The benefits that we want to make sure you're aware of is that they only have one full HMO network. And that's this gold HMO plan here. They don't sell an indemnity plan anymore. This is when people lived in the mountains. They used to be an indemnity plan available for them because there really wasn't a network around. So that is no longer available. They do use the formulary. It's the California Small Group formulary, so make sure you're using that one. And then they also have this HEAL program, which allows a doctor to be in your office or at your home within a 2-hour window, which is very helpful, having the doc come to you versus you waiting in their office. The one thing I want to share with you on the networks is that you can choose up to 5 plans and metallic tiers. So a lot of people will just pick one HMO, one PPO. The reason you want to use all 5 plans is that, let's say I hire somebody at a senior executive level and they love HSAs. Why not actually add the HSA so that way you have the 5 plans available to you while you have a chance? Because if you only pick the 2, you're going to get the 2, and you can't adjust those until anniversary. From an underwriting standpoint, they are the most restrictive, meaning that if you do not have a group submitted by the 20th of the month prior to the requested effective date, you're not getting Aetna. Now, we have seen groups, for the most part, they all come in after the 20th of the month. So it's really important, if you're going to sell a bronze plan, for example, with Aetna, please make sure that you manage expectations for that employer. Because if you send in a 12-1 group and it's on November 25th and everything is completed, they will not take the group. Why? Because you have to submit it before the 20th of the month prior. In that example, that group will roll to 1/1, the rates will change, the plans will change, and your employer is not going to be happy with you. So please be careful of that. There's also no DE9C for groups that are of 20 or more enrolled, which can be very helpful in certain situations. You'll notice that they also have a startup with 2 weeks of payroll. The 90-day exact waiting period is something that's unique to them. So that means that usually it's first a month following 60 days because, again, it cannot exceed 90 days for a waiting period. So the way they do it, there's no charge for the effective date after the first of the month. So let's say it's the 10th. And then the coverage is terminated on the last day of the month. So that's how they do that. So if somebody wants to have the maximum possible waiting period, Aetna may be your answer. So some miscellaneous things. If you're going to renew a group with Aetna, please let them know, because if they don't see that you're renewing it, they're going to start the termination process. So it's really important, if the group's going to renew, just let Aetna know. Otherwise, it just creates a lot of problems, and having to unwind it is something that they don't want to do, and that's why they're encouraging advance notice. So that's what's going on with Aetna. Now let's move on to Anthem, and as we talked about, Anthem is very competitive right now, especially in Contra Costa County in San Francisco. What they've done, you'll see the annual increase for the PPO has been a negative number, and the HMOs have gone down. So because the rates have got more competitive, they have written a lot more business. Now in January, they have not told us when the January rates are released yet, but they have said that it's going to be a 1.5 statewide annual increase is what they're telling us. The most competitive plans that we're seeing now in San Francisco, we're selling the Platinum. The Contra Costa is the Gold. Santa Clara is the Platinum in Silicon Valley. And Santa Cruz, it's the Gold. So a lot of the richer plans are being sold right now that we are seeing with Anthem. They have the new Bronze plan. And one of the things you want to be mindful of is if somebody has medications that they have to have. We have an 82% approval rating when we ask for non-formulary drugs to be covered by Anthem. That does not happen at all with UHC. So they're very strict with UHC. They're very lenient with Anthem as it relates to specifically medications. So please be mindful of that. If you really look at Anthem, because they are the most lenient. They can do a 90-day fill at, let's say it's a CVS, and you'll get the 90 days. There's no savings to it, but at least you have that flexibility. They still have the HEAL program. The Life Health Online is when you're going to call your doctor, and they're going to show up on your cell phone, and you can call your doctor and communicate with them from home. And they do have a pay forward program, which is a cash back. On the underwriting timeline, we have real-time enrollment for any size group. So what is amazing about this is that we get groups with the enrollment information that comes in at 9 a.m. in the morning. We will have your individual employee ID numbers by 5 o'clock that night, as well as the group number. So nobody else seems to have that level of responsiveness because it is a real-time feed that we have with Anthem, which is fantastic. And because they're so competitive right now, having that speed and turnaround is very helpful. What they're doing through December, just want to let you know that they, if you've got the prior carrier bill, you don't need the DE9C for 6 or more enrolled. And their participation is now down to 25%. So if you do have a heavy Kaiser group, I'll use 25% with 5 or more enrolled. If it's 1 to 4 enrolled, you need 65%. Having individual coverage in the exchange as a valid waiver is very helpful, because really the only way you can have a non-valid waiver is if you don't have coverage at all. So the underwriting rules are really getting loosened up for a lot of the carriers, Anthem especially. If we have a startup group, because this economy is booming, the unemployment rate now is 4%. For the most part, anybody that wants a job can find a job, hopefully. If we're going to split off from our existing employer and start a brand new group, they are the most lenient. We can have a 10/1 effective date, and we can have payroll starting 10/1 as long as that group is on the California Business Portal as active prior to 10/1. That group is going to be up and running for Anthem for 10/1. None of the other carriers allow for that, which is very helpful. Then as we go through this, you'll notice the other thing is you can write 2 HMOs networks, but you can only write 1 PPO network. So you cannot offer the group the base plan of the select PPO and let everybody enroll and pick between the PPO select and the PPO prudent buyer. Please remember that. We had a group where the broker offered the PPO, had the select as the base plan, and let them buy up to the PPO. You cannot do that. You can only have the full and the narrow networks on the HMO. You cannot on the PPO. Specialty is something that all the carriers are really pushing for. They have a medical loss ratio of 80% in small group when it comes to medical plans. They do not have a loss ratio mandate when it comes to specialty, dental, vision, life. Therefore, they're able to make a lot more profit in those areas. And what we're seeing is a lot more competitiveness in those areas as well. The reason you want to do it with Anthem is that you have one app, one contract, one contact, one billing system, admin system, and one bill. And so you can put everything together. It makes it very simple. Also with EaseCentral here at the bottom, very easy connectivity with EaseCentral and Anthem to allow us to have that one-day turnaround time. As it relates to dental, oftentimes we like to have things split up. We want the medical with one carrier, then maybe we'll throw in a Delta Dental, and then we'll throw in a VSP, and then we'll have life with maybe Unum. What's happening with groups that are under 10, does it really make sense to have 4 or 5 different bills? When you package it together for groups under 10, we're starting to see a trend where brokers are basically putting one carrier in place, and when you add the discounts in and the fact that the dental is actually a very solid plan, most groups are very happy. Simplifying going forward is the wave of the future. So when we look at this example, let's look at the dental network within Anthem, and let's compare it. So when we look at here in Contra Costa County, there's 731 dentists. We look at it compared to Aetna or Cigna, or even the Delta PPO plan. Having 731 dentists in the network is solid. And this is why I wanted to make sure everyone is aware of this. Anthem does have a very good dental program, so please be mindful of that. The other thing is they have rate bank for groups of 26 and up. So anytime you have a group of over 26, they are extremely competitive and can negotiate that rate down significantly. By bundling it together, not only do you get a 2-year rate lock for the vision, life, and the disability, you also get a 5% bundling discount. That is also taken into consideration. They do with the implants here, and then they also have non-voluntary plans that go into the endo and perio. And they have orthodontia with 5 eligible and 5 enrolled, which is extremely attractive. Most of the other orthodontia start at 10. So having it 5 eligible, 5 enrolled is very competitive when it comes to Anthem. When we talk about the specialty underwriting, again, there's no DE9C required, and again, all you use 25%. With the vision, you'll notice that they have access to a number of different providers, lens crafters, Target, Sears, and so forth. And with the disability, and this is one of the things I wanted to mention, it's interesting to me how we always quote the medical, the dental, the vision, and the life, but disability is kind of an afterthought. When you really take a step back and think about it, medical, if I have a catastrophic medical event, my financial situation could be totally at stake. But if I have a catastrophic dental situation, I'm not going to lose my house, or vision situation. But my paycheck, which is what disability covers, we don't seem to be quoting it. And so I want to make sure that when we look at 12-1 groups, please add disability, because if I can't work, that is a catastrophic situation. And having a disability coverage where I'm going to have paycheck insurance is going to save me going forward. Much greater than a dental or vision situation. I would much rather have disability. So please ask to quote the disability. We're looking at STD and LTD for Anthem down to 2 lives, and we will package it with your quotes, and that way you'll have an additional line of coverage. Your whole point is to be like an octopus, where you're able to go ahead and have as many lines of coverage with that one employer. It just wraps them tighter and makes it more difficult for them to leave you. And actually they get better pricing because they're getting discounts along the way. So please keep that in mind as well. And below is an example of the specialty and how it works and the commissions that you'll be receiving along the way. Why sell California Choice? Now, Cal Choice has been very competitive for years, and the reason is because the Kaiser rates are the same. The Kaiser here, you'll notice, had a rate pass, and their rates for 1/1 are coming out in mid-October. As I mentioned, the Kaiser rates are the same, as well as their Sutter Health and Western Health rates. Those are a match as well. What we're selling now is the Gold Kaiser, as well as the Anthem Advantage for a lot of the out-of-state folks. Anthem plans is that there was some concern about the limited number of visits. So for a lot of the office visits, they no longer have those limitations for the primary care doctor visit, and the out-of-pocket maximums were lowered, and the RX deductibles were lowered as well. So the Anthem plans that were really concerning in the past are actually a lot of the problems have been fixed. So keep that in mind going forward. Canopy, we are very excited to work closely with the Canopy folks and let you know that Canopy is available through Western Health Advantage. It is extremely competitive. And what we're saying, extremely competitive, if I had a Blue Shield group and I am currently have specific doctors and medications and facilities that I go to, and we actually mirror it side by side with the Canopy, where we're looking at Western Health Advantage, and you're going to have access to John Muir and to UCSF. In most of the situations, we're able to find a 90% match with the doctors and the facilities, but the premium savings to go to the exact same doctors is between 20 and 30% savings. So between a Blue Shield group and a Canopy group through Cal Choice, through Western Health Advantage, platinum plans, same doctors, same facilities, same medications, you're saving 20 to 30%. So please make sure that you do quote Canopy within Cal Choice. It's extremely competitive. If you're competing for a group and trying to win an opportunity, please put in Canopy, because you will blow a competitor out of the water, and they'll be trying to figure out, why am I spending 20 to 30% more on a Blue Shield group when I can have the access to the same carriers, same medications, and same doctors, and save 20 to 30%. So please make sure you take advantage of that. We have some brokers that are specializing in Canopy, and a lot of brokers are not quoting it at all. And we had our first broker who lost a broker record because the broker came in quoting the Canopy, and it was overwhelming. It was a 22% rate difference with the exact same providers. So keep that one in mind. Sutter's expanding down to Santa Cruz, and the Anthem EPO, they use the prudent buyer, and selecting the PCP is not required. like it on other EPOs, which is very helpful. Now you have to understand that within CalChoice, you have 3 Anthem networks. You have the Anthem EPO, which is the prudent buy, the largest, but you cannot go out of network. You have the Anthem Advantage, which is the middle tier, which has some set of providers, which are listed here on the screen. And you have the Select, which is the narrowest network within Anthem and no set of providers. So that's how you want to keep it straight. If you go out of network, you know that you do have the Anthem Select or the Advantage available. And again, those are not narrow networks when you go out of state. Those are the blue card. So if I have the option, and if I can, you're going to quote me on the Select or the Advantage, I may go ahead and get the Select if I'm out of state because I still get the blue card and it's not a narrow network and it'll save me money. So keep that one in mind as well. On the underwriting side, you'll notice 10 or more enrolled. All we have you do is they accept the prior carrier bill, as long as the variance is not more than 10%. And then the Kaiser to CalChoice can only happen on the group's anniversary. This is critical because we unfortunately had one of these as well, where the group was on Kaiser, they were moving to CalChoice, they were 12-1, and they wanted to move 9-1. You cannot do that, so please be careful, make sure you understand. Only Kaiser to CalChoice on anniversary. You have to have the 2 adjacent metallic tiers, so it's going to be bronze, silver, silver, gold, or gold, platinum. And then again, the guarantee issue there, if it's 5 or more enrolled, all you need is 1 week of payroll. So these are things you want to be mindful of as it relates to CalChoice. Covered California. We are so excited to finally have a Covered California contract. Now, I know what you're thinking. A lot of you have had a lot of bumps in the road when it comes to Covered California in the past. There has been commission issues, there had been service issues, there have been hold times I've heard as long as 6 hours years ago. I'm here to tell you a lot of those issues have been fixed. So we met with the team, everything has now been automated, and so from what we are hearing, a lot of those problems in the past are no longer exist. So it's important for you to consider Covered California going forward, because we are starting to see an uptick in the amount of business being placed here, because it is extremely attractive for a number of reasons. Number one, they're going to have their 2019 rates out in mid-October. What is selling is that in the Bay Area, the Trio HMO is selling, because the Trio narrow, it's a Blue Shield narrow HMO network, but it has John Muir and UCSF in it for a very affordable price. When you come down to the networks, you'll see that it is Blue Shield, HealthNet, Kaiser, CCHP, Sharp, and then again, for those that are out of state, they're going to go ahead and get the Blue Shield network. What's the difference between them and CalChoice? Number one is they have no administrative fees. You're going to pay $20 to $25 per month for each of your CalChoice groups. That's what the group pays, and an admin fee. There is no admin fee under Choice Covered California. Number two, there's no late fees. So if you're late with CalChoice, there's a significant late fee that doesn't exist under Covered California. Number three is that they have a Blue Shield full network, in and out of network. With Anthem under CalChoice, as we mentioned, it's an EPO only. So these are really significant differences. You do get deductible credit here between Blue Shield and HealthNet. You do not get deductible credit when you're going from Kaiser to either Covered California or from Kaiser to CalChoice. Please remember that, because a lot of employees have satisfied their deductible under Kaiser. When you move them over, they have to satisfy that deductible all over again. And it's heartbreaking for some of the folks that did not realize that was going to happen to them. So again, our job is to manage expectations, so please be mindful of that. The underwriting, you'll see here, the out-of-state, and this is really amazing. If I have one employee in California and I have 40 employees that are in Arizona, as long as I have that one employee and the office is one enrolling in California, I don't have to have that 51%. I can go ahead and enroll the group with Covered California. It's a great answer to a lot of the problems that we deal with out-of-state groups. The Kaiser can move to California off anniversary. That is a huge advantage. Kaiser cannot go to CalChoice off anniversary, but Kaiser can go to CCSB off anniversary. So that's helpful as well. So, and they also have employee-only coverage. this is also big because if we go to a blue collar group, everyone's making minimum wage. And if I offer 50% of the bronze plan to my employees, if they have a spouse and kids, if the amount of premium I'm asking them to pay is affordable, and we usually use it to round up numbers 10% of their take home pay, then they cannot get a subsidy for their spouse and their kids. However, if we offered an employee-only plan, which does not allow them to cover their spouse and children, and Covered California is the only carrier that offers this, by the way, then that means that my spouse and kids did not have access to the coverage, and therefore they were able to get a subsidy. So for the lower income groups, this is a huge advantage because now all of a sudden everyone gets covered at a more affordable cost. The startup here is going to be 2 weeks payroll, which is also very flexible. And then you do have to have the 2 adjacent tiers, so be mindful of that. So we do need the valid waivers though, if the contribution is 100%, so keep that in mind as well. But I would encourage you to give Covered California a try, specifically for Kaiser groups, for CalChoice groups, because it has become an extremely attractive option, and a lot of brokers are moving business in this direction. HealthNet, unfortunately, has had some struggles over the last year. We have not seen them be competitive. They are coming back, though. You'll notice that their HMO rates, their quarterly change was a negative, and the PPO was up. The one thing I wanted to share with you is we're selling the Smart Care plan down in Southern California. They also have Tailored Networks, which is the enhanced care PPO that's down in Los Angeles as well. When you sell the plan designs, you have a choice between Enhanced Choice A or Enhanced Choice B. So we always go Enhanced Choice A. You want the full PPO network in the Bay Area up here. Down in Southern California, you may want to look at Enhanced Choice B. The underwriting, individual, and exchange are valid waivers, and the waivers are not required, so that's helpful with HealthNet. United Healthcare is the last medical carrier we're going to be covering today. And again, their ETA is October 1st to get their 2019 rates out. They use the renewal's current age. This is big. All the other carriers are going to be having the renewal showing what the member's age is when they renew, not their current age. So if I'm 50, I'm going to be showing 51 in all the other carriers, but if I'm with UHC, they're going to show me at 50. And so it's important for you to understand when the employees get their actual rate, you have to make sure you give them what their rate is going to be after renewal, not their current rate, which is under the amount it should be. So keep that in mind as well. What we're selling is listed here on your left-hand side. And again, they offer a Canopy network. We have found that Canopy through United Healthcare has not been overly competitive, and that's why we've been selling more with Canopy within Western Health in CalChoice. The benefits here, they've offered these plan designs. They have a strictly managed PPO formulary, so if you're looking for an exception, as I mentioned before, you're not going to get it. Under the portfolios, it's 4 portfolios. So which one do you pick? So keep in mind when you're looking at this, you want the plan designs that are going to, for example, in Choice Simplified 2, it includes the Platinum and the Bronze HSA plan. It excludes the Alliance and the Focused HMOs. In Northern California, we really don't quote these. So the Choice Simplified 2 is the one that we recommend. When you're looking at staff model HMOs, so for example, we always had United Healthcare alongside of Kaiser. But what if we wanted United Healthcare alongside of Western Health or United Healthcare alongside Sutter? Now you have the option of doing that. So that's the flexibility that's listed here. So Choice Simplified requires 60% and 5 enrolled. Everything else can go to a different HMO model, which is helpful. For groups that are 10 or more, all you need is you don't need the D9C. All you need is a participation certification form. That is extremely helpful. And then owner-only groups are allowed if they're structured as a C Corp, S Corp, or LLC. All the other structures have to have 1 W-2 enrolling. So if you have an employee that's looking at starting up their own company and they're going to take just owners to start with, please make sure that they structure themselves as a C Corp, S Corp, or LLC. That way they can get coverage with United. They're one of the more flexible carriers when we go out of state. Covering California is the most flexible, then it would be United Healthcare. And the individuals are valid waivers. The package savings are listed here. And again, rather than going through all of these with you, I just want to let you know, just like Anthem, the advantage of savings packaging is enormous, because what they're going to do is they're going to allow you to save. Because look at what's happening here. They're going to take this is the medical purchase alongside. If you go ahead and get dental, we take $3 off your medical rate by having dental. These are big, significant savings, so please keep that in mind. And as you add more, you'll see that the discount off the medical can really reduce that medical premium. We have the dental is listed here, the vision, and all these are quality plan designs, and they do have the LTD, as I'm really stressing today. And again, they pay for the pre-tax premium plans, the POP plans, the COBRA admin, and the FSA. So take advantage of that as well, because it's at no additional cost. The ancillary lines we also wanted to share with you that are available are Modicare. So if you do have an executive team, rather than giving them a $10,000 raise, give them $10,000 worth of benefits. That way you can write the whole thing off as a business expense, and you can discriminate against and have it just for your executive team. That's what our Modicare is. Choice Builder, you're familiar with that. We do have the $2,500 annual max. And what's amazing here is that you're able to offer quality carriers all in one package with MetLife, with Anthem, Delta, all together, so that way they get that one bill. And there's no DE9C required. Delta Dental, our top medical carrier, they have another rate pass for 2019. And again, they have a 2-year rate guarantee for Delta. We have Employers for Workers' Comp, and then we also have Guardian as well, that we were seeing a lot of also. The other medical carriers that we have available for you are MetLife. We have Travelers for Workers' Comp. We have Principal, and we have VSP. And with VSP, the rates are exactly the same. There's no additional admin fee, which really makes it easy for you to place VSP through us. And they're a fantastic vision provider. And again, all of this is going to be sent to you, so it's a lot of information, but I just want to make sure you kind of know what's here, so when you receive it, you'll be able to look through it and then become familiar with this, because this is what you're looking at for the fourth quarter. The one thing I wanted to share with you and spend a little time on is Delta has a new partnership, and it is with Unum. And so what they've done is, since the trend is packaging, which is what our theme is today, you're going to package the dental with the vision and the life and the LTD. Well, Delta Dental typically is only viewed as a dental provider, but what if now they have IMED for vision and they have Unum for disability and life? Now we've got a nice package you can offer and simplify to your groups. So what this is, you offer IMED. Delta Dental is the dental provider. IMED, we go through, we have them as your vision provider. We have Unum Life, we have Unum Disability, and we have something called a personal protection plan. And what this is for $6 per employee per month, I can offer my employees a 24/7 teledoc access. And this is big, because if I have an issue, my son recently had a problem swallowing, we've called the teledoc through Anthem, and it's usually $49, or it could be as much as $99. If you pay $6 per employee per month, you're actually able to access that through this personal protection plan, and there's no cost to you. So it's a huge benefit. Then you have global emergency assistance, and you have a legal club, so you have attorneys on call, and you have ID theft resolution. So for $6 per employee per month to get these 4 services is a great value. And we would encourage anyone who has a Delta renewal, please ask for the Unum Life and Disability quote and this personal protection plan, and offer all of that to your Delta renewals, so that way they can see the value and the price points, which are very competitive. The ongoing maintenance of EaseCentral. So right now, if we do an enrollment with you and you have EaseCentral, we do the initial enrollment. In the past, that would be it. Then your job is to go in and add all the adds and deletes and monitor that site. What we are doing now is anytime there's an ad or renewal, a new hire 3 months down the road, we will monitor that group year round. And so you give us permission, we're going in every single day, monitoring that group. As soon as we know 3 months from now that there's a new hire, we email you immediately, say we have a new Anthem employee. We send the new hire information to the carrier. Once it's enrolled and processed, we send you a confirmation back that employee has been processed. The same thing for terminations. Having this available to you is going to save an enormous amount of capacity for your team, freeing them up to do other things. So please let us know if you have any groups that are on EaseCentral that you'd like us to monitor, because we are happy to do that for you. And this is available to you at no additional cost, which is a huge savings for your agency, because now it's like adding another half a person to monitor all of these online transactions. So let us know if you have any questions on that as well. I want to thank you for joining us today. Our time is up. I'm going to be sending each of you on the call today the presentation that we just went through. If we can help you in any way during this very busy fourth quarter, please let us know. We have Tracy and Heather available for quoting, and I look forward to working with you, and we're all going to survive the fourth quarter together. Thanks very much. Have a great day. Bye-bye.